All right, so we're gonna do this glute offload taping that can help with two conditions that are quite painful. When somebody walks to your office and they can barely stand on the affected side, and it can be from something happening in the lower back or that sacroiliac joint, and they're weight shifting and they're not weight bearing on the leg. This is a really good offload taping. So what you want to have them is standing and actually expose it. So most of the time I get them to take their pants down, and I get them to literally pull up their underwear as high as they can, basically a wedgie. But we're just, for today's taping, we're going to use it this way. So for the skin integrity, of course, you've got to talk about the counterindication of tape, making sure it doesn't give any itchiness or redness, or pull it out. But if it doesn't, they probably can keep this 1, 2, possibly 3 days if they get any pain relief. That's what I usually say. So the first part with the fixable is that you're not going to pull anything. It's just to protect the skin. And basically you're going to measure from that gluteal fold to that greater trochanter right up here. So that's your first tape. And this is something that I'm making the video because people can take this video at home and try to replicate what we're doing right now. So you really want to go in the gluteal fold right up here, and then you don't have to pull anything yet, but this is going to give you some really good landmarks for the brown tape. And then you want to measure, or you can pre-measure all your other areas. And then with that, and you want to do this in order. So the first one is this one here. And then the second one is going to go along that sacral line. Here. And right up to that sacroiliac joint right here. Last tape is right here. And again, you want to go from down to up and then sideways back to the joint again. And that's going to be more important with your brown tape. So with the brown tape, you want to make sure you're careful, don't get any hair or shave the hair away. And then we're going to just now do the work where we're going back here, and then we pull this up here to the top. You can always make it cleaner. There. And you're already creating a lift. Obviously ask if it's too tight. Second one, you can measure it. Again, you go from the bottom. Really important to pull up towards that joint. Like this, cut away off the tape that you don't need. And the last part is from the hip. And this is just creating that nice glute offload. Even sometimes gluteal tendinopathies can really benefit from that. And there you go. This is your gluteal offloading taping technique.